Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420-friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. Epilepsy is a chronic neurological condition, characterized by recurrent seizures. Seizures are temporary disruptions in brain activity that can cause a variety of symptoms, including loss of consciousness, convulsions, staring spells, confusion, and abnormal movements. Epilepsy can be caused by a variety of factors, such as brain injury, genetic disorders, or infections. There are many different types of epilepsy, and the symptoms and severity of seizures can vary widely. Epilepsy and other seizure disorders are a qualifying condition for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to epilepsy and its treatment. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. Cannabis can help with epilepsy symptoms primarily through cannabidiol, CBD, which has proven anticonvulsant properties and influences multiple pathways to reduce seizures. While CBD offers documented benefits for specific, severe forms of epilepsy, the psychoactive component, tetrahydrocannabinol, THC, has shown inconsistent and potentially harmful effects on seizure activity. How CBD helps treat epilepsy. Blocks nerve signals. One mechanism involves CBD blocking signals from a molecule in the brain called lysophosphatidylinositol, LPI. In people with epilepsy, LPI can overamplify nerve signals, contributing to seizures. By limiting these signals, CBD can help prevent seizures from starting. Influences neurotransmitters. Cannabinoids like CBD interact with the central nervous system's endocannabinoid system, which regulates neuronal excitability. This interaction helps reduce the release of excitatory neurotransmitters that can trigger seizures. Protects nerve cells. Research suggests that CBD has strong neuroprotective and anti-inflammatory properties, which may help protect neurons in the brain. Regulates calcium levels. CBD may also help control seizures by blocking T-type calcium channels, which play a role in neuronal excitability. It is crucial for anyone considering medical cannabis for epilepsy to work closely with their doctor, as not all cannabis products are the same. Clinical trials have focused on pharmaceutical-grade CBD, which is regulated for consistent dosing and purity. In contrast, depending on the area in which you live and what state regulations are in place to regulate cannabis, over-the-counter, or artisanal, CBD products from dispensaries or online may not be consistently regulated. Their CBD content and purity can vary greatly, and some may contain amounts of THC that could potentially trigger seizures. All cannabis products sold in licensed cannabis stores in Washington state are strictly regulated and tested to ensure that what is in the package and what is on the label is correct. You can learn more about Washington testing requirements on our video, WTF, Washington. These labels don't make sense. Drug interactions. CBD can interact with other anti-seizure medications, particularly clobazam, Onfi, and valproic acid. These interactions can affect drug metabolism in the liver, which requires careful monitoring by a doctor. It is crucial for patients to have an open, non-judgmental conversation with their care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. Certain terpenes, particularly those found in cannabis and some essential oils, have demonstrated potential to modulate brain activity, either alone or in combination with cannabinoids like CBD. Limonene. Found in citrus fruits, limonene is known for its anxiolytic and antioxidant effects. These properties may help manage anxiety and reduce oxidative stress associated with neurological disorders. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene. This terpene is present in black pepper and oregano and is unique for its ability to bind to CB2 cannabinoid receptors. This interaction can result in anti-inflammatory and pain-relieving effects, which may benefit people with epilepsy. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, Gelato, Chemdog, Death Star, and GG4. Linalool. This terpene, which is abundant in lavender and certain cannabis strains, is one of the most studied for its anticonvulsant properties. Its mechanisms of action include blocking glutamate. It may help to minimize seizure activity by blocking receptors for the excitatory neurotransmitter glutamate, which is often elevated in people with epilepsy. Modulating GABA. Research also suggests that linalool interacts with the GABAergic system, which is the brain's primary inhibitory neurotransmitter network. This effect can lead to calming and anti-anxiety benefits. Examples of strains high in linalool include Do-Si-Do's, Lavender, Skittles, Grand Daddy Purple, and Amnesia Haze. Myrcene. Found in high concentrations in mangoes and lemongrass, myrcene is also noted for its potential anticonvulsant effects. Anti-inflammatory. It exhibits anti-inflammatory properties that may help calm inflammation in the central nervous system, which can contribute to seizure activity. Synergistic effects. Some evidence suggests myrcene can work synergistically with other cannabis compounds, potentially enhancing their anticonvulsant effects. Examples of strains high in myrcene include Blue Dream, Grand Daddy Purple, Grape Ape, White Widow, and Tangy. Pinene. These terpenes, found in pine needles and other plants, have demonstrated neuroprotective qualities in laboratory studies. Antioxidant properties. They may protect nerve cells from oxidative damage, which can result from seizure activity. Anti-aggregatory effects. Research has shown pinene's ability to inhibit protein aggregation associated with neurodegenerative damage. Examples of strains high in pinene include Dutch Treat, Blue Dream, Jack Herer, Harlequin, and Strawberry Cough. How CBD works to reduce seizures. Restores brain balance. Epilepsy is often caused by an imbalance between excitatory and inhibitory signals in the brain, leading to abnormal electrical activity. CBD helps to re-establish this balance, calming overactive neurons and reducing the likelihood of a seizure. Blocks a seizure-promoting molecule. A 2023 study found that CBD blocks the signals carried by a molecule called lysophosphatidylinositol, LPI. LPI amplifies nerve signals and can be hijacked to promote seizures, particularly in the hippocampus, a brain region involved in seizure activity. Targets multiple neurological pathways. Unlike many traditional anti-seizure medications that target a single pathway, CBD influences several different systems related to seizure activity. These include neuroprotective effects. CBD has strong anti-inflammatory and antioxidant properties that help protect neurons from damage caused by recurrent seizures. Ion channel modulation. It influences calcium channels, which are involved in regulating neuronal activity. Adenosine reuptake inhibition. CBD can increase levels of adenosine, a signaling molecule that plays a role in suppressing seizures. FDA-approved CBD for epilepsy. In 2018, the FDA approved the first cannabis-derived medicine, Epidiolex, for treating seizures associated with specific, severe epilepsy syndromes. Dravet syndrome, a rare and severe form of epilepsy that begins in infancy. Lennox-Gastaut syndrome, a severe, hard-to-treat form of epilepsy that begins in childhood. Tuberous sclerosis complex, a genetic condition that causes benign tumors to grow in the brain and other parts of the body, often leading to severe epilepsy. The risk of THC. While CBD has documented therapeutic effects, THC has not been shown to have consistent benefits for epilepsy, and because THC can alter neuronal excitability and may trigger or worsen seizure activity in some individuals. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. While progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. It is known that certain cannabinoids may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.